Obesity has been on the rise for many years, and it's tripled in America since the 1960s, and in particular about 20% at least of teens are overweight or obese, and more of them are becoming super obese. I mean, more and more severe levels of obesity. We're seeing teenage patients with obesity-related health problems that normally you don't see until patients are much older. Things like type 2 diabetes, obstructive sleep apnea, hypertension, liver disease. Once adolescents become above a certain weight, and we measure it based on body mass index, it becomes more and more difficult for them to lose weight to get back down to a normal range. So given the problems with obesity in this country, a more open approach had to be taken to ways that we could effectively treat it. And that's why the thought of using bariatric surgery in adolescents came about. It's not for everybody. Patients have to be very carefully chosen for this approach, but for those that are appropriate candidates, it's highly effective, and it can reverse all those medical issues. If a patient enters the program and is an appropriate candidate for surgery and gets an operation, then that's great. But if they enter the program and can start to learn more about themselves and learn more effective ways of managing their relationship with food, and we can work on different issues that might be driving the need to overeat or preventing them from being able to get beyond certain things that will allow them to lose weight, that's also one of the targets of the program too, even without them actually proceeding to surgery. The Adolescent Bariatric program is linked to Changes, which is our weight loss program. So they would enter through Changes, and they would undergo a medical evaluation, and the evaluation would help to determine the best course. They would also be educated during that time as well about what it means to actually do the operation, because it's not an easy path. The procedure is a tool, it's not a quick fix. We will have seminars in which they receive more intensive education about what it means to actually go down the path towards bariatric surgery. And then if they choose to go that pathway, the first step is intensive counseling with our bariatric dietitians so that they understand the changes that they have to make in their diet and their activity in order for the tool to work. And these are lifelong. A lot of the concerns around bariatric surgery have to do with how it will affect growth and development by causing this type of nutritional restriction. How will patients who are teens deal with the major changes that are going on in their lives? An appropriate age to start considering it, in my opinion, is about 15 and a half. By that time, most of these patients have achieved their full stature. They might not be fully mature physically yet, but they are at least at their optimal height. And metabolically, they're starting to become more like adults than they are like children. And 15 and a half is not when they get the surgery. That's when they enter the program. And then they start working through the process. In my experience, the shortest amount of time between entering the program and actually getting surgery, it has been about 9 months. So it's a very intense and lengthy process to make sure it's the right choice for a patient. And that's not just us making sure it's the right choice, that's also the patient understanding and knowing it's the right choice with all the changes that are going to occur for them. The program that we have is very careful in its selection of patients. We don't want to have patients going to surgery who psychologically are not going to be prepared for the changes they have to make, who will have problems with it afterwards when they've undergone this major change in their anatomy that they can't go back on. So we're going to be very judicious about how we choose patients that are appropriate candidates. The procedure that we do here is the sleeve. It's a shorter operation. It's a less intensive surgery in terms of we're only operating on the stomach. We're not also operating on the small bowel. We resect, we take out about 85% of the stomach. So basically, you're asleep, we put what's called a bougie. It's kind of like a guide down so we know where we're going to, what we're going to leave. And then we staple along the side of that bougie and take out that portion of the stomach. So this is more of a restrictive procedure, and it's irreversible because we do take out that portion of the stomach, but we don't do anything with the intestines, so your risk of bowel obstruction is less. Also, there might be an endocrine function there too, because it's thought that the part of the stomach that we take out produces a hormone that might drive hunger and satiety, feeling full. So that lasts for at least about 6 months. So there might be an endocrine function there as well. The procedure is a restrictive procedure because you feel full faster. The advantages are that you don't have as much of a risk of the bowel obstruction, and you don't have to worry about the malabsorption portion in terms of the nutrients that you do with the gastric bypass. With resolution of sleep apnea, you see patients that have more energy, they have more attention, they probably will start doing better in school because sleep apnea has been known to be associated with difficulty with memory and difficulty with thinking and difficulty with attention. So that's a benefit for patients with sleep apnea if we can get that to resolve. Diabetes, obviously, if they're pre-diabetic or starting to have diabetes, reversing that will have a very positive effect on their lives overall. They have more energy, they have more confidence. They come back to clinic looking like different people, and they just feel more certain about themselves. But that's not just from the weight loss, it's from the process that they went through in terms of knowing that they made this possible. They made these decisions that created this outcome. This Adolescent Bariatric program is constructed within the context of a complicated and intensive weight loss program. The whole goal here is not to get you to surgery, the goal here is to get you to healthy. And whether it's going to be by a medical means or a surgical means remains to be determined. And there is very close linkage between the surgical arm and the medical arm, so that if surgery turns out not to be the right option, there are medical options available. If medicine turns out not to be the right option, there are surgical arms available. So it goes back and forth. The idea here is not to focus on the procedure. It's just a procedure. It's a big procedure, but it's a tool, only one part of it. It's not the highlight. The highlight is the weight loss. It's the change. It's the change in the lifestyle, the change in the health, the change in the eventual outcome that we're hoping to create, whether it's by going to surgery or if it's going through a different means.